Good morning, everyone. I'm Megan Cullup, along here with Scott Micklin.
Good morning, Megan Cullup.
Good
to see
Scott
you.
Micklin. Good
Thanks
to
for
see
coming
you.
in.
Good to see you, of course. I wouldn't miss it.
I know, right? It's Thursday, the 14th of May.
It is Thursday, the 14th of May.
And here we are in our local COVID-19 local information program serving San Juan County and beyond from KSJE. So we're glad that you're all with us, everybody. Thank you for joining us. We have a lot of information to pass along today, and so we can get right to that. We're going to be talking with one of our doctor friends from San Juan Regional Medical Center. Dr. Brad Greenberg, who is an emergency medical physician.
Yes.
And then Ruth Brooks is going to be joining us from the hospital, too. She's a vice president down there at the hospital about some of the other things that they are doing to keep everybody safe and to deal with all the patients that they are dealing with, who are both COVID patients and other patients.
That's right.
We can't forget the hospital remains open for
That's
just
right.
regular of us that get sick. So.
Right.
So we have all that. So should we start by looking at the numbers
Yes.
and things like that? So
Let's do it.
Hang on, everybody. Let me call that up. I think I actually have it ready to go. So as of yesterday, we had 143 new cases across our state, right? So we're now at 5,212. San Juan County had 42 additional cases, so we're now at 1,149. 11 additional deaths across our state, and 3 of those were in San Juan County, so that's worthy of note. And then again, the recoveries, as we scroll down a little bit, up by 134.
Okay.
So we now have 1,434 recoveries across our state. And of course, we're looking at this from KSJE.com. We're getting all this information from the Mexico Health Department. They share this every day. And then, of course, the other stories that we have here about the daily statistics as well. So that's important to share. So
Yes.
I'm looking for the other story, and I don't see it. So
I'm remembering the somewhat more halcyon days where there were so few cases, they were able to tell us, like, the age and gender. Remember that?
Right.
In the beginning?
They still do that.
Do they? For all, like, 5,000 somewhat people?
Well, I think they've been doing that, but let me see.
Interesting. Okay.
Right.
Right.
Well, now I'm seeing that my page was not refreshed, so those numbers I just gave
Oh,
everybody
okay.
were off.
All right, yeah, they were.
From yesterday,
They
so
were
my
quite
apologies.
a bit off, actually.
So these were
Thursday.
Tuesday numbers reported on Wednesday. Now we're looking at Wednesday numbers reported on Thursday. 155 new cases, 56 new cases in the county, 12 new deaths, and 6 of those were in the county, and 81 new recoveries. So there. And
there.
This is why I wanted to share this, because when we had updated Navajo Nation numbers, finally they were a bit delayed earlier in the week, but we got their numbers. Again, 147 new cases and 17 new deaths across the Navajo Nation. And then, of course, the other story, the big story, needs to be what the governor said, right? The governor announcing some progress here, and then some restrictions have been lifted for even the northwest corner of the state. And we know that we've had a lot of difficulties with the numbers, and that's what they're basing all this on, are these numbers and some of this strategic looking at how things are coming in over maybe a 7-day period, and we'll look at those numbers in a minute. But the latest is that as of Saturday, San Juan County, as well as McKinley and Cibola County, moves into this kind of pre-reopening phase.
Preparation phase, they were calling it.
That's it, exactly. And that means that non-essential retailers may provide curbside pickup or delivery. Golf courses, pet and veterinary services may open. Gun stores can operate by appointment. But the order to stay at home except for essential outings remains in place. So that's kind of where San Juan County will be as of Saturday.
Right.
So, progress?
That is progress, yeah.
You know?
You can take Boris to get his hair cut.
I can. He's getting a little shaggy, so we'll try to do that. But anyway, I thought that was hopefully good. I know for some it may not be enough. For others it may think it's too much, but it's at least working in the right direction.
It's something, so I'll take it.
There you go.
Some progress. I'll take it.
Exactly. The other thing we wanted to share with everybody are some of the numbers from San Juan County. And so let me call those up real quick and share those with everyone, because the county, again, has been compiling some of these numbers every week when they come out on Wednesday, and we like to share them with you on Saturday, everybody. So that's kind of where we...
Thursday?
On Thursday.
Saturday. We're sharing them right now, Scott.
I'm not coming in on Saturday. I'm just not going to do that.
No. Okay, here we are.
Yeah,
Whew.
I know.
Rough morning.
Can't multitask today. What's wrong with me?
Yeah.
Gosh, sorry, audience.
Sorry, audience. Here we are. Okay.
But this is from the San Juan County website, sjcounty.net, sjcounty.net. and that's the numbers that we're looking at right now. So for viewers, you can see on the screen, the whole state of New Mexico is kind of in the magenta line. You have the dark green is the Navajo Nation. The lighter green is Navajo Nation and San Juan County, and then the blue line is total San Juan County cases. So these are daily cases across the region per day, and you can kind of see those numbers are just kind of up and down, up and down, up and down.
Lots of up and down.
Yeah. So that's why they then look at some of these averages, and that's why we like to share some of these other graphics with everybody and graphs about what we're looking at. So if you take every case per 7 days and add those together, you get a number and a graph that looks like this. It's those same types of things, right? So this is, of course, the whole state of New Mexico is magenta, San Juan County is blue, Navajo Nation and San Juan County is light green, and Navajo Nation cases are dark green. And you can definitely see a downward trend with these lines.
Yes.
And that's, I think, what has gotten the governor's attention and others to maybe move us into this preparation phase.
I hope so.
Yeah.
Yeah.
That's what they're looking at.
Seems legit.
Exactly. So again, and these are as of yesterday, the 13th of May. So that's why we like to share them on Thursdays. Here are San Juan County cases and San Juan County deaths. So again, the up and down, because we're looking at these daily, not really an average. So it's just a lot of up and down. And then the deaths, of course, are just kind of
same thing. Up and down.
Yeah. The largest, I think, was 7, and of course, yesterday we had 6, so that's where things are on that graph. But then if you average them out, you get a graph that looks like this.
Which, again, decreasing.
Right. The number of cases are going down. The number of even deaths are going down if you average them over a week.
Right.
And that's kind of why we're looking at these types of numbers. So it's a little bit clearer maybe to see trends.
I think so.
Whether they're going up or down. But in our case, they're going down, which is good.
It's a nice trend. Let's trend downward.
We like that.
Yeah.
Exactly. Again, Navajo Nation COVID-19 cases in San Juan County. So again, you have the green, which is Navajo Nation COVID cases in the county, and the blue is non-Navajo Nation cases in the county. Same trend, both going down, which is good.
Yep.
We like that. Mm-hmm. And then as we keep going, everybody, these are the daily cases again. So again, it's kind of harder to see any trends from when they're just jumping up and down.
Right.
And then again, the Navajo Nation cases and non-Navajo Nation cases on the average of 7 days. So we share those with you again, so you guys can kind of see, the audience can kind of see what we're looking at and what I know the county is sharing with the state, or the state is sharing with the county, and that's how a lot of these decisions are being made to determine when things get to reopen, how we reopen, how to keep people safe, when you reopen, all those different types of things, right?
Right, that's right. And also we were mentioning that there's 336 cases in the Navajo Nation, which is way less.
In San Juan County.
In San Juan County, sorry. Mm-hmm. In San Juan County, which is way less than the total cases in San Juan County, which I thought was important to point out because I had been under the impression, I guess because of the total Navajo Nation cases, that most of our cases were coming from the Navajo Nation in San Juan County, but no.
No.
And
again, I think you look at population, right? The city of Farmington is the largest community in the county, and probably that's where your majority of cases are going to come from.
87401.
Yes.
That zip code, yes.
That zip code. That's true. And which is the largest zip code.
Sure.
Per population. So there you go. All right, let's hear from our doctors, shall we? Right?
Cool.
From San Juan Regional Medical Center. Again, we appreciate them joining us, and then we'll share some more local information in addition to the doctors when we come back in just a moment. But this was recorded yesterday afternoon, everybody, just so you know, a pre-recorded interview with our doctors from San Juan Regional Medical Center and also Hospital Vice President Ruth Brooks. Joining us now to talk a little bit about conditions at San Juan Regional Medical Center and things that the community can be doing. Dr. Brad Greenberg is joining us, and also Ruth Brooks from San Juan Regional Medical Center. Good morning to both of you.
Good morning.
Good morning.
Thank you for being with us, and we appreciate, again, you both spending some time with us to talk a little bit about things and conditions at the hospital. And, of course, we keep seeing this week, we've seen San Juan County cases become second in the state, second only to McKinley County. We eclipsed Bernalillo County. And so, Dr. Greenberg, can we start with you a little bit about what that means for conditions for you and your colleagues at the hospital?
Absolutely. So what we're noticing is that San Juan County and McKinley County, just the northwest portions of the state, are continuing to have what they call unmitigated spread. So we're continuing in our population to have a pretty robust transmission of the virus throughout our community. And it really represents that we have some way to go before we really can feel confident that this is, quote unquote, under control. What it means for us in the hospital is we're having increasing volumes of patients presenting to our emergency department, increasing volumes of those folks with an influenza-like illness or symptoms of COVID. The caveat being that COVID, and there's been a lot of discussion about this recently among other places in the press too, is that COVID can present like almost anything. So but we're seeing folks present to the emergency department with influenza-like illness. We're seeing folks admitted to the hospital with either COVID or syndromes that are like COVID at increasing rates, and we've seen sort of a steady, not terribly steep incline, but a steady incline of folks in the hospital now. We presently have 36 COVID-positive patients and a handful of others with that are persons under investigation or suspected of having COVID. And seven of those folks are on ventilators, and two of the people under investigation are on ventilators as well. As you mentioned, we really have crossed a Rubicon with cases in San Juan County, where we now have 1,149 cases out of the state's total 5,212. So we really are, we have a significant burden of illness in our community, and we're doing our best to try to cope and adapt with it, but it's definitely having an impact here at the hospital.
Understood. And Dr. Greenberg, can you talk a bit more about that term you used on mitigated spread? We've heard community spread, and are they similar? I mean, does this just mean that we really can't trace or know how it's spreading? There's not just one hot spot. It just seems to be spreading among the general population, or help us understand what that means, because I know folks are concerned about this virus spreading in our community.
I agree, and we too are concerned. What we mean by that is that there's widespread community transmission, and so what it means is that we're trying to, and we definitely emphasize the importance of social distancing, the importance of wearing masks, maintaining appropriate distance between folks if they are interacting in person, frequent hand washing, and whatnot. But it looks like for many potential reasons, we're not seeing the responses that we would like to see as a product of those social distancing efforts. And so we're continuing to see an upward trend, which is in contrast to other areas of the state and the country, which have had either a flattening or a downward trend, which is a product of those social distancing efforts. It's a concerning fact, but we continue to try to emphasize, the social distancing efforts in order to try and flatten that curve. But I definitely feel like staying at home when possible and only going out when necessary, wearing that mask, washing the hands, maintaining appropriate social distancing is more important than ever.
Great, and this is definitely related. We've talked a ton about testing, and can you speak to, we've heard a little bit about this just this week, this antigens test and it being comparable to, say, when you go into the doctor's office and they swab you for strep throat. Can you speak to that?
So I know we've spoken about this several times about how testing is an evolving science. And now, so we have a whole basket of tests, right? We have a PCR, which is a polymerase chain reaction, which looks for the viral RNA, so a specific molecule in the virus, and then it amplifies that, and then we can detect it on a test. That's most commonly the test that's used. And there are tests like that for influenza as well. Also, the point-of-care testing, just like a test you could perhaps perform at the bedside, but not necessarily in a laboratory, those are also available for influenza, and those are antigen tests. We tend not to rely so much on those antigen tests because they do have a lot of false negatives associated with them. And with a brand new test, we are essentially fairly concerned about the problems with both false negatives and false positives for tests that really haven't gone through rigorous validation processes. So we're still waiting to see what happens with antigen testing. So the antigen testing is a different basket than the PCR testing, which is a totally different basket than the antibody testing. So antigen testing is looking for a piece of the virus. Antibody testing is looking for to a specific protein, an antibody or an immunoglobulin that is produced by the body in an effort to eradicate the infection. So, so lots of different testing options out there, but we still the jury's still out on some of this, especially some of it's about the test itself, but a lot of the questions of which there is no real expert consensus is about how we use the data that we get from doing the test. Mm-hmm. So we continue to stay abreast of the developments in the testing arena, but for right now, we tend to rely on the more highly sensitive tests like the PCR test, and we're not entirely certain how antibody testing fits into the entire spectrum thus far. And antigen testing is another link in this chain, but really not entirely clear how it figures into our armamentarium.
Thank you for that. And so as we speak about phasing in, there's a lot of talk about doing temperature checks. You know, I know that I've been to various businesses already, healthcare businesses, where they do a temp check. So my question is, at what point does a fever appear? Like, is it possible, we know about asymptomatic stuff, but if we're going to rely a lot on temperature checks, is that a reliable strategy?
Well, you know, that's a great question, Megan. I think that, unfortunately, what we have is a disease that has a whole range of different presentations. And we would like to be confident that you are well and don't have the illness if you don't have a fever or don't have a cough or runny nose. But as we've seen in a lot of the discussions, both in medical literature as well as in anecdotal reports, as well as really good articles published within print media, is that this illness is presenting in a huge range of different clinical syndromes, meaning it looks very different for different people. And what we're seeing is, and the way that we're thinking about it, is that this is really a new illness with a new spectrum of presentations. And one very common presentation, which is the one that we are accustomed to, is that of a influenza-like illness: cough, runny nose, sore throat, body aches, and fever. And early in our sort of fight with COVID-19, we absolutely relied on symptom-based screening, which includes a fever. I think that there still is value in screening folks for their temperature and asking them about symptoms that are like influenza-like illness. And so we continue to do that, and we screen every employee at the hospital when they arrive for work. Take their temperature, ask a series of symptom screen questions. So I do think that there's value in that. That being said, there has been increasing evidence about both asymptomatic spread, which is folks that don't even know that they're sick and may not have a fever, having the illness and spreading it. And also various presentations of people that either come to the hospital or don't come to the hospital that have COVID-19. There seems to be a curious connection, which we don't fully understand, with a coagulopathy or dysfunction of how the blood clots that's associated with COVID-19, resulting in increasing numbers of things like stroke and acute coronary syndrome and blood clots that can go to the lung. And we don't fully understand what this means, but what that means for us is that we actually test all patients that are coming into the hospital and that are admitted. And we do find the occasional patient that has a clinical syndrome which seems unrelated to COVID-19 that happens to be COVID positive. So unfortunately, the symptom-based screening is not perfect, and we're trying to further our understanding of the illness itself and come up with the best kind of screening. So it seems like there's I think that there is continued value in doing symptom-based screens and temperature checks, but unfortunately, I don't think it captures everyone that's affected by this new illness, of which we continue to have a developing understanding.
Interesting. There's just so much we don't know about this, apparently, even now, Dr. Greenberg, and thank you. Ruth Brooks, I want to ask you a bit about keeping safe when we do have to go out and do have to go out for essential, maybe groceries or what have you. I know a lot of folks are certainly looking at wearing masks. Some stores maybe are requiring their employees to wear masks, and maybe some of the customers to start wearing masks and things like that as we will look to maybe reopen more of our economy. And what about gloves? Can you talk a little bit about that for us this morning?
Oh, sure. Would be glad to. Thanks, Scott. That is a great question. I think what we would like to see, those of us that live in Incident Command, and Incident Command lives at the county and in the city and here at the hospital, we would love to see everybody required to wear a mask and everybody to be practicing good hand hygiene. So one of the things that one of our caregivers had brought to our attention recently was being out in the public and seeing some people not wearing masks, but more importantly, people that are choosing to wear gloves and not doing it appropriately. And so they're wearing gloves while they're in the grocery store or wherever they may be, and then they get in their car still wearing their gloves, you know, and doing that kind of thing. They need to be taking those gloves off and then using some kind of hand hygiene, whether it's antiseptic wash or washing their hands vigorously, and then getting in their car. I would also highly recommend, if you've been using the gloves inappropriately, wipe down your car on the interior to make sure that it is clean. Important to wear all these things, but it's also important to wear them correctly.
Indeed, and I guess the idea being, right, is that as we touch things at the grocery store with our gloves, and if we don't take those gloves off or change those gloves, that stuff, that potential virus is still on those gloves. I open my car door, I touch my steering wheel, and now it's in my car because I've touched it with my gloved hand.
Yep.
Your car is a petri dish.
Yes, well, it is anyway, but even more so with gloves, apparently, is what the problem is. So, and with the incident control that you're working on, Ruth Brooks and others at the hospital, you mentioned we've talked to Mike Mestis just on the program on Wednesday, and so this is part of that coordination between multiple entities in our community, right, to kind of get on the same page and make sure everybody kind of knows what everybody else is doing and all that transparency that seems to be so important to deal with an issue such as this?
So I would say we all run our own incident command, and then when you were talking to Mike, they're really coordinating all the efforts throughout the county. I've worked in a lot of places and lived in a lot of places, and I have to say the people of San Juan County, including myself, are the luckiest people that we have such great interagency activities that we really take down the political blind spots and work together and use our resources appropriately and really don't let those other types of objectives get in the way of what we're trying to do for our community. And I think we are just so lucky to live in a place that's like that. We hear other counties and the battles that they go through because the agencies don't work together and they're competing for resources, and we share our resources. And we openly share our resources.
Yeah, we hear that a lot. At least I hear that a lot on this program when we talk to school superintendents and others who talk about how everybody kind of works together in the cities and the counties and the hospital, of course. I think your point is well taken, Ruth Brooks, and I appreciate that. And so I would guess that with your incident command there at the hospital, you are watching the numbers, the census numbers, and that's kind of what you share then among your fellow workers there as they know how to respond on almost a daily basis, right, to conditions that are ever changing at the hospital? Is that kind of also what you do?
So within Incident Command, we try to maintain really good situational awareness of all the aspects of the response. So that includes looking at the human resource component, the finance and administration component, logistics, which is all the different materials and supplies required for this response, which we've had conversations about personal protective equipment, but the logistics elements in this particular event are really considerable. And then we have folks that are thinking about what we do next and how we're going to do planning. So there's an entire section that does planning, and then there's an entire section also that does the operations, which is the actual execution of all the different care and all the different programs and different service lines that have had to be stood up that were novel, that didn't exist before this, that we have had to build, and now we have to keep track of as things go on. And we also have a command staff that focuses on safety, focuses on the communication of public information, and also has representations for liaison. So liaison officers that basically have specific responsibilities to do outreach and connect with organizations that are external to San Juan Regional Medical Center. So we really try to stay on top of this entire basket of things, which is it's a huge thing, requires ongoing effort from throughout the organization and multiple meetings and lots of great work by a lot of extraordinarily highly motivated people, and to try to make sure that the hospital is able to function in these new circumstances, and also to make sure that we're continuing to provide services for those residents of the Four Corners, COVID or not COVID related, and also make sure that we are out there trying to communicate the right information to the public, and so they can stay informed too. So we're hard at work every day, but it's the work of dozens and dozens of people within Incident Command, and also the hundreds of people here at the hospital who are doing the great work of taking care of people.
Very good. Well, we appreciate your time, both of you, yet again, to share again with our listeners and viewers what the conditions are at the hospital, what other things that you are seeing in the community, and other things coming out in the science and the research about this very novel and very new and unknown virus that we are dealing with. And of course, we're not alone; we're dealing with it across the world. But it is, I know, frustrating for folks who want to kind of get back to some sort of normalcy. And there's talk about that in our neighboring states. There's talk about that in our own state, and I would imagine from a medical perspective, you all just want to make sure that we do this smart and do this the right way, so we don't have another surge of cases 3 weeks from now. Absolutely,
without question, you put that perfectly.
Thank you.
We would like to see things open up as well, and we, just like everyone else, have a desire to have things return back to something that looks a little bit more normal. But just like you said, Scott, we are so concerned about early reports coming out of Georgia and Texas, which have increasing rates of COVID infection as a product of their opening, and we want to make sure that we do it right. I think that we really would like to open up once and do it the right time, and make sure that we have all of the different elements that have been described by some folks in the White House task force, things like contact tracing, case tracking, adequate testing, and really good processes to support those people who find themselves in quarantine. All of those things really become important and are almost like what they call gating criteria or prerequisites for doing the opening. And so we are all together in this experiment, basically, which is this hasn't happened before, and we're all trying to figure out how to do this, and definitely trying to work with and utilizing the guidance of state and of the folks at the federal level to do so. There's no real quote unquote right way to do it, but we have to exercise caution and be conservative, because what we're looking at is the health of all the people in our community, health of ourselves, our loved ones, friends, and family. And we need to make sure that we make really good choices about how we open and when we open. And we have to combine those decisions with what our healthcare infrastructure can do and how we can, how the public health folks in Santa Fe are able to support our reopening and do so in a safe way. So we fully support the idea of opening, but we definitely want to stress some caution about how we do it to make sure that we do it once. Like, let's say I don't want to open up and then have to close up and then open up and close up. I'd much rather open up once, have the structure, and then we could get our economy going, and try to get a little bit of a normalcy back into each and every one of our lives.
And,
Yeah.
and until that happens, I think something that people need to be really aware of is really taking care of themselves and their mental health. This is difficult and hard times. We're locked in this room for 10, 12 hours a day, every day with the same people, and it can drive you a little crazy. And I can't imagine being home with my kids, trying to do home classes and all those kinds of things. I mean, there's so much to this. So I think if we can all remember to practice extra kindness, maybe more than we normally would do when we're working with others or reaching out to people who are home alone and have no one to talk to. And so I think now of all times, we have to make sure that we are being the best humans we can be and being a good community member.
Yeah, and sort of one more final note, just because I think this might be a helpful image, and I want to see if you two experts agree, but there was this San Francisco Chronicles article that has been quoted multiple times now about the hammer and the dance strategy. So you lay the hammer down to try to stop the progression, flatten the curve, and then after that it's sort of a dance in talking about phasing in and out. Would you think that was a helpful image?
I think that does create a helpful image. And really, though, that dance is all of the things that I just mentioned. It's, if you bring the hammer down, it's a blunt tool to try to do social distancing to try to stop the virus from rapid progression and exponential spread. And then once you feel like you've done that enough, then you try to cautiously reopen while deploying resources. And those resources are contact tracing, so people tracking down who has the illness, who they had communication with in person, and who may have been exposed. Ongoing testing resources, the tracking associated with all those things, and then subsequent isolation and quarantine. And that is the dance. That's the dance that goes on for some time and requires all of society's participation and cooperation with this. Because we all have to recognize that we're in this together, and following the instructions of the contact tracers and making sure that we're staying quarantined, but then also looking out for those people that are quarantined and making sure, do they have enough food to stay home, and are they getting contact with enough folks where they can feel secure and confident that they're both looked after and getting the right kind of care. I think that dance is something that we haven't really seen or experienced broadly in the United States of America in recent memory. But I think that that's a great visual, but it's a dance that we are all going to be doing, all of us. We're all going to have to do it. We're all going to have to do it together. And if you find that you're not necessarily quarantined, you might have to figure out how you can support people that are. Mm-hmm. And that's the way forward. We don't want to be locked down forever, and we don't want to open up widely and have people get real sick and have a considerable excess mortality. Mm-hmm. What we need is this middle way where we devote resources to it, we engage in this dance, we cautiously open up, do it the right way, and hopefully turn the COVID-19 pandemic into something which is much more manageable.
That's what we need to be concerned about. That's very true. Well, thank you both for joining us and for your time. We certainly appreciate it. Dr. Greenberg, Ruth Brooks from San Juan Regional Medical Center. Thank you both very, very much.
Thank you.
Thank you, guys.
You're welcome. Stay well, and we will talk to you again soon.
All right.
Sounds great.
Bye.
Thank you very much. our guests from San Juan Regional Medical Center. And I'll just throw it out there. I'm going to apologize right now for stepping on toes because that's what I do when I dance. So I'm just going to apologize.
I've seen you dance.
There's going to be toe stepping.
Oh,
I'm sorry. There's no way around it.
I've seen you. You're actually, well, you're much more talented than I am at dancing.
I don't know about that,
Oof.
but we
It's rough
appreciate
seeing when I dance.
we appreciate the medical professionals for sharing their expertise with us on the show.
That's right.
We definitely do.
Of course.
And there you go. And now we're back.
And now we're back.
Yeah.
Costume change.
Costume change. Exactly. That's it. And we're talking about dancing.
Yes.
See? So
I think it's it's the lights have to be very dim for me to get
For
out
you?
on the floor.
Oh, okay.
Which is, and I have to be dragged out on the floor.
Noted. Okay.
Yeah, I don't ever just pull myself out there.
No,
I have to
not-
be physically removed from the seat.
Not even at a wedding or bar mitzvah? or
No,
something
yeah,
like that? You
no,
just-
just physically remove me. There's only one way to
Got
get
it.
me out there.
Okay. There you go.
Bar mitzvahs are funny. Are fun though.
They are fun.
They are fun.
Yeah, indeed.
That's more fun dancing. We're all locked. You know, the linking of arms thing.
Right, group
Yeah.
dance. Would you
The
be
group
more
dance.
to group dance than
I
a
would be
couples
more
dance?
inclined to do a group dance for sure than a couples dance.
Okay.
But also like group dances are cheesy too. I just don't. I'm too self-conscious.
Wow.
On the floor.
Okay. This is Megan, up close and personal,
That's
everybody.
right.
So
See?
there you
Something
go.
new every day.
We've learned something new. Thank you for sharing. All right. Before we go today,
Yes.
everyone, we do want to remind you about the event that's happening here at San Juan College for the Navajo Nation, our donation drive. San Juan College has a gigantic semi-tractor trailer truck parked near the Henderson Fine Arts Center, and they are collecting these donations. This is what the tribe has told us is specifically needed by residents on the Navajo Nation. Liquid hand soap, paper products, paper towels, toilet paper, tissue, non-perishable foods, bottled water, baby necessities like formula, diapers, and wipes, and then dog and cat food is also needed on the reservation.
Yes.
So the college has been collecting these items all week. They will continue to do so until Saturday, and then that truck is going to head off to the west,
To the west.
to the Navajo
Into
Nation.
the sunset.
Go west, truck. Exactly.
Go west.
And so you can come on campus again, and it is contactless donating. Right? You can come
right.
in, pop your trunk. And the volunteers will come and take the items out of your car, and you never have to get out of your car, and you can stay safe. And they will load those items into the truck, and they have gloves, they have masks, they have all those different
Yeah.
things that they need to have to stay safe.
I was thinking about contactless stuff.
Yeah,
This
that's
morning.
the new word, right?
because
The new
right.
buzzword.
Well, that and just because of the pre-phasing in, right? The preparation phase. And I mean, as much as I really hate this time, which I do, I have noticed some changes that are kind of nice. Like if you do a drive-through, a lot of them now, you just stick your own card in
Right,
the machine.
the
And I'm
machine.
like, why haven't we been doing that?
Right.
Like there's just certain things now that we're doing that make more sense to
And
me.
they put your food in like a acrylic bucket or
Yeah,
or thing
like
to
that.
give
I
to
hope
you.
stays, right? Like I really don't like this time, but I hope that stays.
Right.
That makes sense to
But
me.
of course, a human had to put the bag in the acrylic thing
Yeah, but
in the
it
kitchen.
is.
So, sorry, but they did.
But there's probably nothing more germy though than those pin pads.
No,
right?
I agree with you.
Like that's a thing.
When you're checking out, I agree.
Right,
with you.
right.
But anyway,
So
there's the donations again, everybody. If you can help, we hope that you will. And again, today from 3 to 6, tomorrow from 1 to 4, and then the Saturday morning from 10 to 1. And it's right on the main campus, San Juan College, near the Henderson Fine Arts Center, and kind of near the Pottery area and the bookstore area of campus. So if you're familiar with where that is, that's where you're going. I know there are signs to direct you, and the idea is if you drive up, contactless, and you don't have to worry about having to get out of your car.
Right.
And it is much appreciated, and we know how much our friends and neighbors on the reservation are in need. So this would be a great thing to be able to share a little bit with them.
that's right.
So, and I know we've gotten donations from as far away as I think Durango.
Yeah.
I know there's been some folks I know in like the Bloomfield area that have been collecting from their neighbors, and they're bringing in a whole carload of stuff to drop off maybe today or tomorrow. So it's been a great
Keep
thing.
up the good work, guys.
Exactly. On that note, shall we call it a week?
Let's call it a week. We'll see you guys Monday.
We'll be back on Monday, everybody, and we appreciate you being with us and sharing this program to spread all the local information. Stay safe and stay well, and we will see you back here Monday at 9 a.m. on KSJE.